What's an example of how maybe your organization is looking at things that are working well in different lines of business? You see them figure out, could that be scaled to other lines of business like your neck of the woods in government, and cloning those and just creating a new process that works to access hard to reach members?
The answer I'm going to give you is probably something very familiar, but most often forgotten, but is the gateway to the health plan: customer service, right? We know customer service is that mile marker in the entire member journey. And why do I say that is a bright spot? Right. So a little bit about Mass General Brigham. When I say Mass General Brigham, people think of world-class healthcare system, which it is, but we are on the health plan end, right? So a truly integrated delivery system. And primarily our roots are in Medicaid and commercial. So Medicare Advantage was launched only 2 years ago, and we're growing super fast. And for 2 years in a row, our commercial markets have won JD Power #1 award for customer service. So that's our bright spot. And we do know, talk about ROIs, right? Numbers. Most 4+ star plans, if not all, they generally tend to have customer service in-house. Because these are the people the organization is invested in. That means they're going to give better service to our members. Not a lot of new plans do, especially in Medicare space, launch customer service in-house because it's a huge lift. But in our case, we actually do have customer service. We are not even completing 2 years and 3 months. 90% of our customer service in-house. That comes from our commercial experience, where that really drove our customer satisfaction and growth for us. But in Medicare space, it's a little bit more challenging, right? It's highly regulated space. So we had to think through this. We had to look into investments, starting with technology, tools, policies, procedures, because everything is a part of the program audit. Then we had to look into bringing more experienced agents. Medicare is probably the most complicated customer service. The questions you get from seniors, our customer service leader actually made sure we were getting experienced hires, and especially from local market. And we also have invested very heavily into forward-looking training. And when we talk about tools and technology, we're also talking just not the robust tools and technology, but even evaluating how can we use AI,